Are stimulant medications safe for kids with ADHD? Let's talk about what the research shows. If you've ever worried about whether stimulant medications are safe for kids with ADHD, you're not alone. There's a lot of misinformation and disinformation out there, particularly on parenting social media. So let's break down what the research actually says about their safety. Stimulant medications fall into two categories. One is methylphenidate formulations such as Ritalin, and the other is amphetamine-based medications such as Adderall. They are among the most researched medications in all of medicine. Studies spanning over 60 years have consistently found that when prescribed and monitored properly, these medications are safe and effective for children with ADHD. The American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry both recognize stimulant medications as a first-line treatment for ADHD due to their strong safety profile and effectiveness. One of the biggest concerns parents have is whether stimulant medications can lead to addiction. Research actually shows the opposite. Untreated ADHD is a risk factor for substance abuse, but properly managed ADHD with stimulant medication lowers that risk. A study published in the journal JAMA Psychiatry found that individuals with ADHD who were treated with stimulant medications were significantly less likely to develop substance use disorders later in life. Another common and understandable concern is whether stimulant medications increase the risk of heart problems. Large-scale studies have found no increased risk of serious cardiovascular events in children taking stimulant medications. However, it's always important to screen for any underlying heart conditions before starting medication. When properly prescribed, stimulant medications do not change a child's personality. Instead, they help improve focus, impulse control, and emotional regulation so kids can better navigate daily challenges. If a child seems overly sedated or not themselves, that's a sign that the dosage might need to be adjusted or that particular medication is not the best one for that child. Key takeaways. Stimulant medications have been extensively studied and are considered safe and effective when used as prescribed. They do not cause addiction. In fact, they reduce the risk of future substance abuse. There is no significant link to heart problems in children without pre-existing conditions. They do not change the child's personality, but help improve focus and self-regulation. Want more ADHD parenting information backed by research? Subscribe to the ADHD Dude YouTube channel for scientific-based strategies that actually work.